And we're live.
Thank you. We are live. This is Senate Health and Welfare. We're back with about 10 or 15 minutes for a conversation, and then we'll be hearing testimony on S-109, 188, when our witnesses are here. So I just wanted to hear some thoughts. Let me share with you what we may be able to do with some of the information we heard yesterday in the public safety, housing, and health and welfare discussion, the joint meeting. We do have a number of bills in our committee that testimony helps to inform. One of them, the mental health bill, the protocol bill for how different services deal with folks in an emergency situation, so we can put that, some of what we learned there. And there are other things that we want to think about, and I want to hear your ideas, but just so you know, the House Human Services is working on an update. I think I shared this before, working on an update with the General Assistance Program that hasn't been updated in a long time. And I think we're hearing some of the concerns that we hear about our homeless or our hotel population or our GA population, our weather population of folks who are not getting some of the services that they need, or we need to restructure how all of this happens. Well, all that testimony yesterday, I think we can put into some of the bills that we have. We've got the Recovery Center bill, and the mental health bill, might have another couple, and then the GA bill that comes over. So if you have ideas that you'd like to share at this point, or you'd like to just write down and hold for when we get to those bills, you could do that. So go ahead.
I think it's going to judiciary, but there's also the safe injection site bill and other, or did it come here?
H72 is here at the Harm Reduction Centers.
Awesome.
And we will be putting that on our agenda, and we have some folks already, like Steve Pavick, who testified yesterday and has some really good. Scott Pavick, thank you. I know who he is. So Scott provided some good background and research information, and there are a couple others. So we'll bring folks in on that sooner or later.
Yeah, we did a lot of work on the off session in the opioid settlement advisory committee on that.
I know that. Yeah. I know that. And the House is very interested in having it go forward. So we will look at that. We'll get it up on an agenda. And that is another bill that will support change going forward. Yeah. Any other comments? I was just stunned by some of the testimony that we heard yesterday. Some of it you were very aware of, but some of it became real. Some of it was the Decker Tower testimony.
Yeah, well, so can I did want to say that a lot of the testimony was very compelling, but that testimony in particular, as someone who lives in Burlington, that was, again, compelling, but also I felt like it was slightly taken out of context. I feel as though that building has had its struggles and its issues for many years. Yeah. And we were only getting sort of like a snippet. I'm sure they have been exacerbated and increased, and yet it would have been helpful to have a little bit bigger picture on the situation of that particular housing unit, for what it's worth.
That's our job. Well, it could be economic development's job, it sounds like, with the concerns around eviction and rental. But we certainly have.
Yeah.
I mentioned this in my questions of the general counsel from Department of Public Safety, but firearms are showing up in all sorts of places where they should not be. And I think that's really impacting the safety of Vermonters and social service agencies, including, I stepped out to have a conversation with a public transit authority,
Yeah,
director. They're, showing up on public transit buses, including one instance where somebody brought a gun on a public transit bus in my district that also on the bus were a group of students going on a field trip and using the public transit bus to go to the field trip, and somebody boarded the bus with a loaded firearm. So those kinds of issues were not addressed sufficiently, and I don't believe are being taken seriously
Is there
by our
a
law
bill-
enforcement.
and is there a bill in judiciary that talks about use of firearms within certain public?
There is a
spaces?
bill, Senator Clarkson and I, about,
Sure,
firearms at polling places and
Right.
public demonstrations
Right.
and some, I can't remember the third thing. But it's definitely an issue. We've had to have, a town had to shut its town offices down because a member of the public repeatedly came with a firearm threatening the town manager. This is a problem across our state. There are too many firearms and people are bringing them to places they should not be bringing them. And
So is that, there may be some suggestions that we could, is that bill, that's not in your committee, is it?
it's in judiciary. I think all the firearms bills really are in judiciary.
So maybe we can make suggestions about how to, make that a little more expansive. I mean, if you're talking about public transit where that's the school is using that public transit, then there should be some authority from the education folks.
Well, I mean, I think it's
Others.
broad, that was just one
No,
example.
no,
I think
I'm
it's
just
much
saying
more broad
That-
than-
Yeah, no,
than
I'm,
just
that's
the
what I'm
education
saying,
thing.
we can broaden it. I'm not suggesting that that's the only thing, I'm saying there might
Yeah.
be other areas that we can broaden it to, including recovery centers or harm reduction centers or whatever,
Public libraries.
public libraries, those things.
Isn't it more the need for a review of open carry laws? I mean, isn't that kind of the crux of it? I mean, if instead of cherry picking this and that, which, emotionally sound,
I would love to have a full review of open carry. I think a comprehensive approach is a better approach. And we need to really think about whether that's open carry is a thing we should have in the state. I mean, we do right now.
so that's what,
But
I think that's what ought to be addressed, not just, picking a school or a bus or bus. It's just to answer the question. Is it, where do we want to go? Where are we? Where do we want to go? What if
Yeah.
anything needs to change?
I completely agree, Senator Weeks. I would love to have that conversation and,
So
I'm
whose
glad-
committee, who would have jurisdiction?
That's
Judicial?
judiciary.
Okay, so we do have a lot, to talk about, and there are some other more discrete issues that we've identified previously in our fall meeting about timing and collection of information and so on. So don't lose those ideas and bring them back when we get the GA bill. And we can send a memo to our friends in judiciary. If you want to, if you're interested, Senator Weeks and Senator Hardy could put together some language that we could put in a memo to judiciary asking them to consider the following. And,
I'd be happy to
yeah.
work with Senator
We'll
Weeks on that.
get Ledge Council to put that together and then send it over.
My last comment is just that, I think I've been involved in 3 joint hearings with you now in the last 3, 4, or 5 months. And I just want to thank you because I think they're a great way to kind of set a tone and set an intention and move toward a goal. I really like that format. I do feel yesterday there was a lot of emotional testimony and sometimes it was very, it really struck fear, I felt, in a lot of us listening. And my only worry is that sometimes I think fear kind of paralyzes us and it doesn't give us the freedom to sort of like be innovative and look forward at different solutions. And we look backward and we kind of go to what we're comfortable with. And that's my only concern, and it's not just from that joint hearing, it's in the media and,
Oh, yeah.
it's, yeah, so,
Well, and the thing is, I'm not to cast aspersions on having information from public safety, but when you start talking about public safety issues in public places, I'm not talking about guns now, but just our discussion yesterday, it does bring that sense of concern and fear. Yeah, it really does. Oh, okay. All right, well, we're gonna move on to, well, thank you. I do appreciate that. You're welcome. We're gonna move on to S109, but wanted to let you know that we do have some testimony planned for next week. We can talk about next week, tomorrow. If we got some time today, I'll do it. But on the note of joint meetings, we will be setting up a joint meeting with Senate Agriculture on the section of the PFAS bill that relates to agriculture. We'll talk to Senator Starr about doing that. And then they may want to do something different from what we might do, but it's scheduled for next Friday. And I think we'll be meeting in their committee room. All right. And we'll go through some other stuff later. So let's move on to 188. It's not on there. We did one. We're on S188. Thank you for correcting me. And we are looking at an act relating to support for child care providers. Do you want to testify together? How do you want to do this?
No.
You've got somebody on screen. Okay, why don't you come on up? Who's, okay, good.
Just listening.
Janice,
What's the number of the bill?
188.
Okay.
It is the, act relating to supports for child care providers and could be considered technical corrections, but could be considered something new. So we want to clarify what it is.
Okay.
Thank you for being here.
Yes, I'm happy to. For the record, Jan McLaughlin, Deputy Commissioner for the Child Development Division within the Department for Children and Families. And I submitted written testimony on S188, and I will just use that as my talking points.
We don't have that up yet. Aaron Roche, it's under Aaron Roche. No?
No.
Jan McLaughlin.
Oh, I have to read that.
Mhm.
Okay.
She has the name tag.
Yep, got
I
it.
do, we have new name tags?
No,
Registration, it's official.
We have something from Aaron Roche,
Yes.
but now I have yours because I refreshed. Okay.
Refresh, yes. Okay. So, in terms of our testimony, I just want to start by acknowledging that the administration absolutely recognizes how critically important early childhood educators and other staff within our regulated childcare programs are. We know that they are like the lifeblood of the program, they are the heart of quality, and they are the driver for like capacity within the system. So absolutely understand all of those. And then related to this the specific proposals that are in this bill. Again, we appreciate the sort of the intention to recruit and support staff working in regulated childcare programs with prioritized access to childcare financial assistance and the idea of I think the intention is for it to be sort of a $0 weekly family share. But we do have a number of questions about sort of the targeting of the program, the design of it, the cost and implementation. So I'll just run through those pieces. So the first, right, is that the proposal only supports staff who have children that need childcare and have children that are of the age to receive childcare financial assistance. And in previous years, the administration has proposed income tax relief for staff that work within regulated childcare programs as a way to support a broader variety of the staff that are working in and not have it be tied to like the specific age of your children and what their needs are and the choices you're making as a family in terms of that care. In terms of the costs, right, the additional costs are not in the budget right now. It will be tricky to estimate them precisely because we need to know more about sort of the household income of childcare, our childcare workers, as well as, understand like how many of them have age eligible children, how many, and then of those people that do, like how many children do they have? So it's gonna be tricky to figure out what this costs, especially related to when we know that many of them would receive at least some benefit through the expanded CCWP benefit. In terms of other sort of design considerations, the bill refers to a childcare provider, and just saying that kind of maybe potentially needs to be better defined. If it's just people that are offering direct care of children, if it's like other staff members that support the program. I know that in previous iterations of support for the workforce, that definition has been tricky, right? Where people sort of was focused maybe on people providing the direct care. But there's other staff members, right, that help programs run. And so sort of thinking through that design consideration, and also, but also recognizing too that in a multi-service organization, it gets even trickier. So just flagging that as something to work out. The bill includes regulated family childcare providers right now, and currently regulated family childcare providers are not eligible for childcare financial assistance for their own children. So even if we disregard income, they're still not eligible in the way that things are designed right now. And also the bill references family income, and we talk about household income, and just wanting to make sure, were we talking about the same thing or not there. So those are some design considerations. And then we do definitely want to flag the timeline for implementation. We do really feel like July 1st would not be possible if this passed at, later in the spring.
Just looking at how little you have to do.
I know, yeah, there was a few other things we're trying to do, but just flagging, it would take at least 6 months, I think, to get this, integrated into into all of our processes and systems, both just the procedures and things like that, and training of the eligibility specialists, as well as the IT system changes that would be needed. And flagging that anytime we add something else to the list, something else has to be adjusted or reprioritized. And we still have a long list of things that we need to implement from Act 76. So things like that. So just long list there. And we're still trying to get to our next phase of the IT system upgrade related to all the licensing functions that is on a platform that is still red flagged by the Agency of Digital Services as unstable and
Is that the
security. This one for us is BFIS.
BFIS.
That's what it's called, Bright Futures Information System.
Right.
And so wanted to flag those things for you. The other element of the bill is regarding health insurance navigators. And just want to note, again, not in the budget, and that it feels like it would be important to understand sort of why the experience of those working in regulated childcare programs is different than than other workers, and whether or not there's any existing resources within Vermont Health Connect and sort of its existing assisters program that could be helpful or leveraged in this case. And then we were also asked to comment on the tuition rate increase cap established in Section 12 of Act 76. And want to just broadly say, we do support the goal of affordability for families when it comes to childcare. But this particular statute so far has generated a bunch of questions. It has the possibility to create a lot of churn for the division, and uncertainty for programs is, I think, the thing we hear a lot from programs is it's for those that want to do longer term business planning. This feels tricky for them, so the question is it really, and then is it actually achieving its goal of assuring affordability for families? So I put a lot of words in the testimony of just explaining to you what we've done so far in terms of trying to figure out what this would look like and how we would implement it. We've advised programs on it. We've, provided a memo explaining it to folks. I mean, some of which is people are like, what is this? How might we calculate this? How will we know? So it was just sort of that kind of clarifications. the feedback that we've seen, that we've gotten more recently is, again, it's just sort of limiting programs' ability to plan ahead. And sometimes, for some of them, they feel like to sort of achieve their programmatic goals. So there's a program that wants to plan on beginning to offer health insurance, and they don't know what the tuition rate increase cap will be 2 years from now, and it's, you know, like causing a lot of anxiety about like, are they not going to be able to increase higher? So that's the kind of thing we're hearing from programs. We've also heard from some programs who have kept their tuition rates low because there has been the childcare stabilization funding coming in through ARPA and the readiness payments. They haven't done increases in the last 3 or 4 years. And they, I think, had been imagining that as they got to, that they were going to be able to do an increase for families who could afford to pay as the other childcare financial assistance expansions come into play. And then the final point that we've heard, I think, that another point that we've heard is just that the early care and education financing study that the legislature commissioned, you know, identified a cost of high quality care, and that this cap could force some programs to keep their rates below what the state has already acknowledged is a cost of high quality. And then from an implementation perspective, I just wanted to offer that sort of as a agency, we haven't had a role in regulating programs tuition in the past, so we don't really have like a robust system set up to do that. We're doing it right now it's new enough that we're definitely just doing education for families and education for programs. If when questions come in, our intention is to continue to implement on a complaint basis. But I will say it can get really complicated because childcare programs all have very different rate structures. And so they have different rates for kids at different ages, for whether or not you're a 2-day kid, a 3-day kid, a 4-day kid, or a 5-day kid, for whether or not you're some people have before care and after care. Some people have school year tuition and summer tuition. Like it's like, which one of these exactly are we looking at, right? Like in any moment. And it would be a lot to ask our licensors to have them, you know, to like have the business skills to like go through all of that and like assess pricing on every year, and like to actively enforce that would be pretty robust. And also programs change rate structures, right? Like eventually you used to have a rate structure that was every child, you know, you had different rates for different ages, and then you switch to saying, actually, we're just gonna have a flat rate for all kids. Like, what do we do with that? So there's just there's some implementation things that, depending on where we go, you know, how this plays out could be tricky. There also are plenty of programs where like, okay, 7.2%, like we weren't planning to increase that much. They're not that stressed about it. And then, yeah, so that's sort of what I guess that's what I wanted to offer about sort of what our perspective is and what we've observed about it, and sort of how we've been thinking about it so far. Definitely open to sort of the conversation, you know, with you about what you feel like a adjustment, a correction would be. I feel like the options rates like could eliminate it. We could delay the effective date, could increase the index, you know, make it 2 times the index. You could ask for you could establish that we could ask for a waiver under certain circumstances for programs that want to increase above it. That might, you know, offer that out. And then, or another idea could be for it to kick in only after a program exceeds the cost of quality care that's been identified. So,
but so you've given a lot of options
Yes.
that you would have to implement.
right.
So the best recommendation for us is the one that fits with your interests and ability to operationalize, and whether it happens this year or it happens in the future as things begin to sugar off is probably important.
Yeah, I mean, I think the trick, like with this continuing to, with the cap continuing to exist, it will continue to provide some uncertainty for programs, because right now, right, it's set up on it and on an index, and you don't want, like, I don't want to use last year's number, right, to set the, so it's like March is when, like, end of March index, I'm using that to set the, 1.5 times that for July through the next June. For example, like we just said it, and then, right, people are like, oh my gosh, for people who offered health insurance, they're like, whoa, that was, so like, is that kind of, like, when it's there, like, that sort of level of uncertainty is really tricky, I think, for programs.
No, I can understand that completely. It's kind of hard to go.
Yeah, thank you, Janet, for your testimony on all three of these things. I appreciate the cautions you say about the first two. I share many of the same concerns and don't feel comfortable moving forward with either of them. But more this last one, Senator Gulick and I come out of a school finance background, and schools have long had to contend with a variety of different types of rate caps, so to speak, and it's always hard to implement one because the shock of having one is really hard when there hasn't been one in the past. So a lot of what you're hearing is just, this is a new thing and nobody likes to have their rates capped or whatever the equivalent of a rate is, their spending capped, their whatever capped. So part of what you're hearing is just that, and I know you know that, but I think I would be reluctant to make a big change on it yet. It hasn't even actually gone into effect yet. This coming year is
No, it's in effect.
It's in effect right now.
Yeah.
But I would love to hear more. I mean, in your testimony, we understand this rate cap limits programs' ability to manage costs in response to unforeseen circumstances. Possible the division may seek a waiver in the future, a waiver authority in the future. And I think that might be the best way to deal with it, because eliminating the caps or making them excessively more cuts into the affordability of the program, of the whole system. It cuts into our ability to continue to fund it too, because it's really expensive. But I do understand that there may be instances where a waiver, but I would want that waiver defined so that we,
we can't do that. This is something that would be great to have.
Okay.
Yeah, so if you can think of, like, under what circumstances would you want to issue a waiver, and so that there are guardrails to it to protect both you, so that you can say, these are the guardrails, and also to protect the sort of integrity of the rate limits.
Okay, makes sense. I realized one other point that I didn't make, but there was my testimony, was I've heard, at least from one legislator, saying that some of the thinking around it was that you don't want, like, a new owner to come in and, like, jack up the rates. And I just want to offer, like, from the Child Development Division's perspective, like, a new owner is a new program. Like, we can't hold a previous owner to new owner, right, to the previous owner's, like, rate structure and rates. And so to the extent that that was the goal, like, I just want to be clear that that's not accomplished.
That makes sense.
Okay.
They are new.
There were a lot of those decisions that were just like, this happened. And then,
Right, and I mean, I think that in the future, maybe we look back at that, and we're constantly re-looking at, tinkering with the school funding formula, and we can certainly tinker with this one, but it's so early. I'd rather see a sort of well-defined waiver process to start with, I think.
Yeah, so, and I would just offer, I think there's a lot of this is tied to, right, like, it's private or nonprofit businesses and their programs, right, and their and tuition paid out of pocket. It's not necessarily the government, and it's also in a system that we know has been, significantly underfunded and undervalued over the years. And so I think that's also relevant, related to whether or not now is the moment to implement a tuition rate increase cap.
Right, yeah, I definitely hear you on that.
Yeah.
And So, I mean,
Having some, if there is a recommendation to be made, it would have, I would let, it would have to be something that you would be able to handle.
Mhm.
So we have Aaron Roche on the testimony and you're here, so let's listen to your testimony and then we'll decide how to proceed. I think there's some hesitation here. You're already doing an amazing amount of work. So this may not be the time to load it on further. All right. Erin, welcome, thank
Hi,
you.
thank you.
Right up.
Okay, I did submit testimony.
Okay,
Um,
and we're over in 12 minutes. so-
yes, so I'm thinking, I have some slides, but I'm thinking in the interest of time, I will just, let you browse them. And I'll just talk to what I was going to talk to.
Terrific, no, that'd be
Okay.
great.
So for the record, I'm Erin Roach. I'm the Vermont Director at First Children's Finance. And I really appreciate you inviting me to come here and talk to you all today. Also, this is not usually part of my job, and so I might be a little bit nervous and a little bit unpolished, so I
You're
just
fine,
want to give
we're
you that
glad you're
disclosure.
here. So Please share with us what you have.
Yeah, I'm really excited. I'm really excited because we started, so First Children's Finance is a national nonprofit. I want to give you a little bit of background about who we are and what we're doing in Vermont so that when I get to the part that's relevant to sort of S188 and or Act 76, you have some context for where my comments are coming from. So First Children's Finance is a national nonprofit. I opened the Vermont office almost exactly a year ago. In fact, I saw a social media post from 1 year ago this morning saying, oh, this new office is going to open. So that was exciting. Anyway, I started the end of January, this new office in Vermont, and now we have 4 more staff. So there's 5 of us total. Soon there will be 6. And we all operate remotely. We happen to be in 4 different counties in the state. So anyway, we're kind of all over the place. I live and work in Addison County, so I have some affiliation with Senator Hardy. Anyway, and we all came to this office with some experience, years of experience in the childcare sector in one way or another. And I think that's really important to note that that we've kind of come up through the system to some extent. So I wanted to mention that. In Vermont specifically, we are focused on supporting childcare businesses. In other states, we work more closely with like community level solutions or with sort of systems and policy solutions. But in Vermont at this time, what we are really focused on is supporting childcare businesses. In fact, we have a contract with the state right now to, I'm skipping around a little bit, but to offer business and technical assistance to childcare businesses. And that's really what started this office here in Vermont. And so for just about a year, we have been working really closely with childcare businesses on answering their questions, helping their businesses be more sustainable through a variety of services. I wanted to just call out our mission nationally and in Vermont is to grow the supply and business sustainability of excellent childcare. And so I think that that speaks to a lot of the questions that I've heard this committee ask over the last couple of weeks. So we started out on this business sustainability part with our business and technical assistance program. In the late summer, early fall, we added also through the Child Development Division of the Department of Children and Families, we added an infant and toddler capacity building grant program that we're administering. And so we're kind of working on both sides of that, right? Growing the supply and the business sustainability of childcare. So who we are in Vermont, doing both sort of access to capital and business sustainability through consulting services and professional development. One thing that we weren't planning on when we opened this office a year ago was Act 76. right? That sort of changed everything. And we had just hired our third staff when that passed into law. And rather than just doing sort of our usual slate or our sort of usual 3 months slate of trainings and webinars, we pivoted pretty hard and built out a series of explainer videos. We worked really closely with the Child Development Division to make sure that what we were saying about the law and what the questions that we were getting was really being effectively answered, and making sure we understood how this was all rolling out. And I think that we've been able to help these childcare businesses really be as effective as they can in this very new environment. So anyway, that's what we've been doing a lot of. And we do expect that sometime this year, we have a loan program, we're a community development financial institution, and we do expect that we'll be bringing capital into the state specifically for childcare businesses. Stay tuned for that. So that's just a little bit about the organization and what we do. I wanted to share a little bit about what we have done in this past year. So I've been getting ready with my report for the state, which is due at the end of the month. So I can tell you with some confidence that in the 11 months that we were in operation, we conducted 26 trainings with 273 participants. I didn't bring a long list of what those trainings are, but I'd be happy to share that. That's of interest. We also made 6 of these Act 76 explainer videos. We did most of those over the summer, and we have handled just over 300 technical assistance inquiries, and that is with a staff that was 3 people up until July. So I just feel like we have seen this volume. An awful lot of those inquiries have been about Act 76 questions that people had, and like helping them to figure that out, but also just general questions about how do I make a budget? I'm really worried about my cash flow. Where do I look for funding for this sort of project? I want to expand. I want to have health insurance. I want to add benefits, right? There's a lot of all kinds of questions. So that's what we've been doing. The other thing I should note that last February, the end of last February, we conducted a business health survey among all the childcare programs in the state, all regulated programs, and asked them about how their business was doing. This was intentionally timed with the end of the stabilization grants. That was February, was the last month those grants went out. And so we wanted to know how people were feeling, what their sort of fiscal state of their business was. And we did a webinar, I think in March last year, and we're gonna repeat that survey again at the end of February this year. So we're really curious to see how things have changed or are starting to change. I did include in my testimony one brief statistic from that I thought might be relevant for this committee, which is that 39% in that survey a year ago, 39% said that they're struggling to maintain staffing, and 30% said that they're under-enrolled due to a lack of employees. And so when you're thinking about childcare financial assistance for childcare workers, I mean, you're thinking about helping them with health insurance and other things. I just want you to keep that in mind. Anyway, so I just thought that might be helpful. I'm talking really fast.
This is great.
Okay,
This is
okay,
good. We're fast listeners.
Okay. The other thing I wanted to quickly tell you about was this infant toddler capacity building grant program, which, like I said, we started working on this in August, September. Grant applications were due at the end of October, and I just got an email this morning that the first payments went out to our 44 successful grantees. And so I have a little slide in there with some numbers about those grantees. It's we funded 9 new family childcare homes, 10 new childcare centers, 15 expansions of childcare centers, and 10 projects that will preserve spaces, either like very new programs or programs that have been struggling for one reason or another.
Vermont numbers or national numbers?
Those are Vermont numbers. Yeah, so 9 new family childcare, 10 new centers, 15 center expansions, and 10 projects to preserve spaces. And the slide that's in the testimony shows you the county breakdown for the 1,000 spaces that that these grants are funding.
And where did the funding come from?
That came from,
Is
the
it Act
child-
76 funding? Okay.
No, it's not F
Oh, it's
76
not. Okay.
funding. It's,
No.
through the Child Development Division has, run this grant program in partnership with Let's Grow Kids for the past several years. I don't remember exactly.
It is mostly ARPA funding right
Yeah.
now.
Oh, okay,
Yes.
okay.
ARPA,
Right now. But we've used other funding,
yeah.
we used CCDF funding in the past too.
So what's the future, what's the future funding source? Is it, I guess the question is like, is it already determined or is it speculative?
There's a $10 million quality capacity incentive fund that was included in Act 76. That would be part of the source, and then also the CCDF, the ongoing child care development fund or federal funds, would be part of it too.
Yeah, sure. Thank you.
The other thing I wanted to mention about those 1,000 spaces is that, right, childcare as an industry is very labor dependent, right? You have to have so many workers for so many children, right? That's in regulations. And so these, in addition to 1,000 spaces, they expect to create 229 new jobs, which is like a good and bad news story, right? Because new jobs is always good news for economic development, but getting and retaining those workers has been challenging in the past. Okay, so on to the more relevant things. So I included some of our reflections on the urgent impact of Act 76 in my testimony. I think that Act 76 has been amazing in a lot of ways, and I will offer that I've been working in this space for something like 7 years, and this is the first time I've experienced palpable optimism from the field. I just, not everybody is like jumping up and down, but the fact that we got 44 grantee, like successful grantees, that's more than that program has ever funded in one go. And I wasn't sure we could move the amount of money in grants that that the state had available, and so we ended up having to like do an amendment in order, because when we did get more really good requests for funding. And so I just feel like people sense that this is becoming a viable industry. We have also been getting phone calls from employers and like property developers, community centers that are interested in like large capital projects to build new childcare centers in all parts of the state. And I don't feel like that level of energy has been there in terms of developing more childcare. And so
Not since the 70s.
yeah, so I did want to just make sure I reflected on that. And
So I'm gonna suggest that you have a lot of information to provide, and it would be helpful, I think, if we could invite you in again. And I'm looking behind you with Janet McLaughlin. We will invite both of you back in if there's time for you, and have this continuing presentation and then conversation, because I know you have a slide on S-188, and there are some concerns that we have about loading additional work, but also benefits on top of benefits at this stage of the game.
Yep.
But then also the rate issue seems to be one that maybe there's something we can support. So I'm going to invite folks back in to look at 188 specifically, and possible language or recommendations that we can or cannot make. I'm not sold on the bill myself yet, so we want to make sure that we have the information that will help us put it forward if it's done properly. So
great, I'd be happy to do that. Could I make just one last comment?
yes, please.
Mainly because Deputy Commissioner McLaughlin talked a bit about the cap on rate increases, and I just wanted, and it is in my testimony, but I just wanted to offer that, you know, one possible suggestion in the short term might be to pause implementation of this and spend the next year, because there really wasn't any time to think about what the implications were, but to spend a year and watch what happens to the rates, because as the Deputy Commissioner said, not all programs want to raise their rates more than the cap. And it would be really interesting to understand what would happen. We don't study, we don't track private programs tuition rates. We've never done that before. In fact, part of Act 76 said that you need to publish your rates, right? That had never been a law before. And so it does seem like this is a great moment to spend some thoughtful time watching what happens while programs kind of recalibrate. Anyway, I just wanted
So
to leave you with
your
that.
charge between now and then is to, you know, evaluate the first two parts of 188, but also then put your heads together, I think, and if we can bring us something that makes sense and that we can work with, we'll see how it goes.
Great, I'm happy.
There are no promises in this, but there certainly are promises that we want to have enough information to make the appropriate decision. Thank you.
Thank you for having me.
Yeah, thank you very much. We'll see you again, I know.
Thanks,
We'll
Sarah.
see Deputy
Yeah.
Commissioner